bold new move is shaking public health policy on the West Coast. Washington, Oregon, and California have decided to break away from the Centers for Disease Control and Prevention, CDC, and create their own independent vaccine guidelines. But here's where it gets controversial. This decision stems from a deep distrust of the CDC under the leadership of Robert F. Kennedy, who many believe has steered the agency away from science and into political waters. In an unprecedented step, these 3 states have launched the West Coast Health Alliance. This coalition plans to develop and promote vaccine recommendations based on guidance from nationally respected medical organizations, deliberately moving away from the CDC's evolving stance. Their goal is to provide residents with stable, science-driven advice they can trust, regardless of fluctuating federal policies. The governors of Washington, Oregon, and California didn't mince words. They described the CDC's politicization as a direct assault on the health and safety of the American people. In a joint statement, Governors Bob Ferguson, Tina Kotek, and Gavin Newsom condemned the CDC as having transformed into a political instrument that prioritizes ideology over genuine science. An ideology they warn could lead to serious negative health outcomes. They affirmed their commitment to protect their populations from policies they view as risky or misguided. Why such strong language? Robert F. Kennedy, known for his outspoken skepticism about vaccines, has dramatically reshaped the CDC's Advisory Committee on Immunization Practices by replacing all previous members with individuals aligned with his views. Recently, this newly formed committee significantly narrowed the CDC's COVID-19 vaccine recommendations, now suggesting it primarily for seniors at high risk of severe complications, marking a notable retreat from earlier, broader vaccine endorsements. This new alliance is not starting from scratch. It mirrors previous collaborative efforts during the COVID-19 pandemic, when these states coordinated vaccine approvals and distribution to navigate federal delays and inconsistencies. Now, by formalizing their partnership into the West Coast Health Alliance, they aim to maintain control over public health decisions and immunization policies. And this is the part most people miss. By rejecting the CDC's guidance, the states risk creating fragmented public health strategies in the United States. Could this lead to confusion among residents who move between states or undermine national efforts to control preventable diseases? Or is it a necessary pushback against what some see as federal overreach and politicization? What do you think? Should states take the lead in public health decisions when trust in federal agencies erodes? Or does this set a dangerous precedent for a divided healthcare system? Share your thoughts below.